Right. Well, it's just a minute or two after 10. I think we have a pretty good showing so far. So we've got a tight agenda, so I think we'll just get underway. So good morning again. It's great to see so many familiar faces here this morning and many new faces as well. Thank you all for joining us for today's presentation, Food Insecurity and Economic Conditions During the Great Recession and COVID-19 Crisis. Today's event features 3 speakers who will address the issue of food insecurity here in New Hampshire, its impacts on residents and families, and some approaches to meeting the growing need that has increased as a result of the COVID-19 crisis. Our program will begin with an opening presentation from NHFPI policy analyst Michael Polizzotti, which will highlight NHFPI's recent December 2020 report on food insecurity, along with some more recent updates and additional analysis. Following Mike's presentation, Eileen Laponis, Executive Director of the New Hampshire Food Bank, will share the food bank's approach to meeting the unprecedented level of need during this current crisis. And Laura Milliken, Executive Director of the New Hampshire Hunger Solutions, will highlight federal and state programs to address food insecurity and what might be done to more effectively meet the need here in New Hampshire. Together, these speakers will provide you with important insights to help you better understand how food insecurity is impacting residents and families and efforts to address the ongoing need here in New Hampshire. We are grateful for the support of the New Hampshire Children's Health Foundation, which provided funding for NHFPI's food insecurity research for our December report and for today's event. I would like to introduce Gail Garceau, President of the New Hampshire Children's Health Foundation, to say a few words.
Thank you, Anne Marie, and good morning, everyone. Food insecurity has been a priority of the New Hampshire Children's Health Foundation for years. Requests for funding in this area have always been high, but especially so this past year during the pandemic. We're so pleased to partner with the New Hampshire Fiscal Policy Institute and to have funded their research, which produced their recent issue brief, Food Insecurity and Economic Conditions in New Hampshire and the Nation. Thank you, Anne Marie, and your staff for the work you do. We're all looking forward to learning more this morning. So thank you very much.
And thank you, Gail, for those very kind words and for the Foundation's support of this project. Before we begin the program, I'd like to review a few logistical items. We'll ask that you all keep yourselves on mute during the presentation and use the Zoom chat function to submit any questions during the event. Phil Sletton will be moderating a Q&A segment following the presentations and will monitor the questions as they come in. We'll endeavor to hold all of the questions for that final Q&A segment, although we may pause briefly following Mike's presentation in the event there are technical questions that would benefit from earlier clarification. We will be recording this event and we will be posting the recording and the presentation slide deck on our website. You will receive an email following the event this afternoon with these links as well as some additional summary materials. So please watch your inbox for that follow-up note. And now it is my pleasure to introduce our first speaker, NHFPI policy analyst, Michael Polizzotti. Michael, over to you.
Well, good morning, everyone. Thank you, Anne Marie and Gail, for your remarks and introductions. My name is Michael Polizzotti, and I'll be presenting this presentation, Food Insecurity and Economic Conditions During the Great Recession and COVID-19 Crisis. And like Anne Marie mentioned, the analysis and findings in this presentation are drawn from NHFPI's December 2020 issue brief with updated data in relevant areas. So before beginning, this presentation will provide some definitions and background into what food insecurity is and what its impacts are. The rest of the presentation will be divided into 2 main sections. The first one discussing food insecurity trends prior to the COVID-19 crisis, where the analysis identified elevated levels of food insecurity for longer in New Hampshire than the nation after the Great Recession, related factors surrounding the uneven economic recovery during that time period, and discuss the important role of nutritional aid programs as well. The second section will discuss impacts of the COVID-19 crisis on food insecurity in New Hampshire and the economic challenges facing Granite Staters and the important role nutritional aid programs have during times of economic decline. So with that structure, we can provide an overview of food insecurity. So households are considered food insecure if they indicated that at some point in the last year, they were unable to acquire adequate food for one or more household member because of insufficient money or other resources. Food insecurity also has some profound negative impacts on children and adults, especially for children. These include the risk of developmental impairments, worse performance at school, and behavioral and social problems. So in terms of where the estimates of food insecurity come from, the data is first collected by the US Census Bureau, and it's collected annually within the current population surveys food security supplement questionnaire. After this data is collected, official estimates of food insecurity are calculated by the US Department of Agriculture. The USDA calculates the average of the last 3 years of data to provide more reliable statistics, especially at the state level, and comparison over time of these 3-year estimates provides a rolling average for us to look at. So using their calculated estimates, the USDA has identified that food insecurity levels tend to vary nationally based on certain household characteristics, composition, and geography. So these disparate levels of food insecurity identified by the USDA in certain households occur nationally. So some of these households that face higher levels of food insecurity include households that have children, households that are headed by a single parent, households that are headed by individuals identifying as Black or Hispanic, and households that are living in or near poverty. And near poverty is defined as up to 185% of federal poverty thresholds. So to note, the federal poverty threshold for a household with 1 adult and 2 children in 2020 was about $21,000 in yearly income. And 185% of that threshold would be about $38,500 in yearly income. So additionally, households living in large principal cities and those living in rural areas also experienced higher levels of food insecurity overall as well. Now, the USDA doesn't provide that level of identification at the state level for these official estimates in food insecurity, but given what the USDA has identified in linking elevated food insecurity levels and to households living in or near poverty, we can shed some insights using some poverty estimates in New Hampshire. So poverty levels in New Hampshire, the most recent estimates from 2015 to 2019, show that individuals who identify as Hispanic or Latino, Black or African American, children, those with less than a high school degree, and those who are unemployed or worked part-time faced higher poverty rates in New Hampshire. And similarly, when looking at the most recent estimated poverty rates for families, certain groups and family compositions faced higher levels of poverty as well. And that includes families where the householder identified as Hispanic or Latino, Black or African American, families with children, especially those with young children, and families that rent their home. So the identification nationally that food insecurity impacts households at a higher rate if they're living in or near poverty may also indicate that here in New Hampshire, these same groups that are facing elevated poverty levels, in the state, may also be the ones facing higher food insecurity levels as well. Now that we've gone over some of the background on food insecurity, what it is and who it impacts, we can discuss some of the report's analysis on food insecurity prior to the COVID-19 crisis, specifically during and after the Great Recession. So the Great Recession lasted from December 2007 to June 2009 and resulted in a large increase in food insecurity levels across the nation. Nationally, food insecurity levels started to begin declining slowly and steadily around the 2011 to 2013 period, whereas levels of relative food insecurity appear to have remained elevated for longer in New Hampshire than the nation and didn't appear to decline until much later on in the recovery. So here we can see some of these trends in food insecurity during and after the Great Recession. So the green line represents these 3-year estimates for the United States. The dashed black-gray line represents New England, and the blue line represents New Hampshire. And again, these are the 3-year estimates, so there is overlap, but what this chart is showing is a rolling average of these midpoint estimates. So we can see that the declines in food insecurity levels across the US began during that 2011 to 2013 period. But in New Hampshire, it doesn't, New Hampshire doesn't appear to have declined, doesn't appear to have experienced a clear decline until much later. So to dig deeper into how food insecurity levels have changed in New Hampshire and the US, the analysis looks at the real and relative changes in these estimates. So using the same data from before, from the previous slide, excuse me, but instead of just tracking the midpoint estimates over time, this graph here shows the period over period changes in food insecurity levels in New Hampshire and the nation. So again, the blue line here represents New Hampshire and the green line represents the nation. So positive percent changes indicate that food insecurity level midpoint estimates increased compared to the prior period, and negative percent changes indicate that food insecurity midpoint estimates declined compared to the prior period. So using this comparison here of the period over period changes in food insecurity estimates, we can see that the declines in food insecurity levels may have occurred more slowly in New Hampshire than the nation overall over this shaded period from 2010 to about 2017. And again, using the same data, measuring the change in relative food insecurity levels, but this time indexed to a point before the Great Recession, appears to show that elevated levels of food insecurity lasted for longer in New Hampshire than the nation, again. So what this chart is showing is that is the percentage change in the rate of relative food insecurity levels in the New Hampshire and the nation. And again, New Hampshire is the blue line and the nation is the green line. So we know that food insecurity levels rose nationwide as a result of the Great Recession. But this graph shows that the relative levels of food insecurity were elevated for longer in New Hampshire compared to the nation, again, represented in that shaded period from 2010 to 2017, where the blue line for representing New Hampshire is higher than the green line representing the nation. So given those trends in food insecurity, we can discuss several factors that might be related to that potential that relative levels of food insecurity were elevated for longer in New Hampshire than the nation. And some of these factors include the uneven recovery from the Great Recession, changes in employment opportunities in the state, limited income growth for low-wage workers, and more significant declines in the purchasing power of these lower wages in New Hampshire than the nation overall, and different policies to support low-income individuals as compared to other states and the nation. So during the recovery from the Great Recession, some of the industries contributing the most to employment growth in New Hampshire were industries that paid lower than average wages. So this chart here shows the changes in employment over the recovery from the Great Recession, where the green bars represent the actual increase in the number of jobs in that industry, and the blue bars represent the average weekly wages that industry paid in 2019. Where the blue line, horizontal line, represents the statewide private sector average weekly wage in 2019. And we can see that significant portions of the job growth during the recovery from the Great Recession occurred in industries that were paying below the average weekly wage. So in addition to those employment growth factors, real wage recovery, growth, and just the overall change occurred differently based off different wage levels. So this chart shows that wages higher than the median in New Hampshire experienced larger overall levels of wage growth over the recovery from the Great Recession, while wages equivalent to the median or below the median saw no clear wage growth during this recovery from the Great Recession. So taking a look at just that group of 20th percentile wage earners, so these are individuals who earned about $12 an hour. What would be $12 an hour in 2019? We can look at some of the changes in their purchasing power year over year in New Hampshire, New England, and the nation to see how things compared. So this chart is just tracking the real or inflation adjusted changes in the 20th percentile wages. But here we have the blue line showing those changes in New Hampshire, the dashed gray line showing those changes in New England, and the green line showing those changes in the nation. And this chart shows that the relative 20th percentile wages saw the most significant decline and only recently recovered back to pre-Great Recession levels in New Hampshire, while the real wages for New England and the nation overall didn't decline as significantly as New Hampshire and recovered more quickly as well. So in addition to those changes in employment opportunities in New Hampshire and the lack of clear wage growth for lower wage earners over the recovery from the Great Recession that may be contributing to these elevated levels of food insecurity for longer in the state during the recovery, the policy landscape in other states compared to New Hampshire may have contributed to this as well. So the policy landscape in other states may have aided in boosting the overall incomes and overall economic security of lower wage individuals and families who are more likely to experience food insecurity. And some of these policies include things like minimum wages, state level earned income tax credits, which target individuals and families with lower incomes, different compositions of housing assistance, childcare assistance, and other forms of direct assistance and aid. So while policy landscapes for certain forms of aid certain forms of aid and support may differ between states and across the nation, certain key programs are available pretty consistently across the nation. So the important role that nutritional aid programs played throughout the recovery from the Great Recession and other key aid programs is evident, especially for the SNAP program, which is the Supplemental Nutrition Assistance Program, also known as the food stamp program here in New Hampshire. And this is the largest nutritional aid program in the state and in the nation. So this program directly aids individuals by allowing those facing financial hardships during times of economic decline to still put food on the table. And while directly aiding those individuals in need, individuals and families in need, another positive effect of this aid is stimulating the economy. So Moody's Analytics and the USDA estimated that for every dollar invested into new SNAP benefits, about $1.50 in economic activity was generated, indicating this positive multiplier effect that SNAP has. So now that we've discussed some of the food insecurity trends since the Great Recession and the important role of nutritional aid programs, we can transition to some of the impacts of the COVID-19 crisis. So the impacts of the COVID-19 crisis have been significant. The shock to the economy has led to unprecedented levels of unemployment claims, which indicate many people losing employment income. And while many economic indicators, including unemployment claims shown here, have been tapering off from their most extreme levels, they're still elevated and they're not back to the place that they were before the pandemic began. So by looking at the distribution of unemployment claims by industry, this chart shows that since the pandemic began, a significant portion of initial unemployment claims have been generated by industries that pay lower than average wages in the state. And this indicates that a large portion of the job losses and losses in employment income have been most acutely felt by low-wage workers. So this chart, the blue bar here, represents the total initial claims filed by workers in that industry, and the green bar represents the average weekly wage or the average wage that that industry paid, whereas the green horizontal line represents the average weekly wage in the state. So while some of the economic challenges of the pandemic appear to have impacted those earning lower wages most acutely, the level of overall need for economic assistance in New Hampshire has also been rising as well. So this chart here shows that the unduplicated open cases for economic assistance, which include programs like Medicaid and SNAP, among others, have increased overall, and they've been steadily rising since the pandemic began. Now, when looking just at SNAP enrollment in New Hampshire, the graph shows here that there's been some initial increases during the initial portion of the pandemic, where more individuals were enrolling for SNAP, but enrollment has since leveled off. And SNAP in particular seems to be an example of where the program enrollment doesn't exactly reflect the levels of need in the state. So in order to continue to gauge the hardships and the level of need in New Hampshire, we can turn to some estimates provided by the Household Pulse Survey. So the Household Pulse Survey is conducted by the US Census Bureau. And the point of this survey is to get an idea of what sort of hardships and challenges households are facing as a result of the pandemic. And some of the findings from this survey, which occurs either weekly or bi-weekly, depending on when you're looking at it, is that nearly half of New Hampshire adults reported a loss in employment income between March and July of 2020. At the end of 2020, about 1 in 4 households expected future employment losses, and about 1 in 3 reported difficulty paying for their usual household expenses in New Hampshire. And there have also been increases in elevated levels of food scarcity in New Hampshire as well. So food scarcity as defined in the Household Pulse Survey is when a household or an adult in a household indicates that there was sometimes or often not enough to eat in the last 7 days. And since data collection began in April, between 4 and 12% of households in New Hampshire have indicated that they've been lacking enough to eat in the last week. Now, in terms of expenses overall for difficulty covering regular monthly expenses in New Hampshire, and these include things like rent or mortgage, food, insurance, anything that's a regular monthly expense. This graph here shows that about a quarter of households indicated that it was somewhat or very difficult to afford these expenses just in the first half of January 2021. When tracking these estimated levels of households indicating difficulty covering expenses over time, this chart shows that since August 2020, between 1 in 4 and 1 in 3 households in the state have found it somewhat or very difficult to cover their usual household expenses in the last 7 days. Now, it's important to note some of the significant recent policy changes to aid individuals and families impacted. And some of these include extended and expanded unemployment compensation, the economic impact payments, increased maximums to SNAP benefits, moratoria on certain evictions and foreclosures, rental assistance, and other changes and additions to nutritional aid and safety net programs throughout the pandemic. Now, in summary, some important points to remember from this presentation are that food insecurity varies between groups, and households living in or near poverty, headed by individuals identifying as Black, African American, or Hispanic, and households with children faced higher levels of food insecurity. Another key point to remember is that during the recovery from the Great Recession, levels of relative food insecurity appear to have remained elevated for longer in New Hampshire than the nation overall. And the uneven economic recovery from the Great Recession, combined with differing policy landscapes between New Hampshire and other states, may have affected levels of food insecurity and the recovery from the Great Recession as well. More important key points to remember is that some of the most vulnerable Granite Staters have been impacted by the COVID-19 crisis. And these are the same Granite Staters who entered this crisis less than ideally equipped to weather it. Another key point to remember is that the COVID-19 crisis has appeared to have led to increases in food insecurity based off of what we know about the hardships and estimated levels of hardships that Granite Staters are indicating. Also, another key point is that providing aid to individuals and families most impacted by this crisis is going to be key in aiding them with the challenges they're facing immediately, while also stimulating the economic recovery as well. And the potential exists for those short-term solutions, but also long-term benefits that come along with reducing food insecurity for adults and children based off the negative impacts we know food insecurity has on adults and children. So more information and details about what I discussed and citations are available in NHFPI's December 2020 issue brief on our website. These slides will also be posted online. And with that, thank you all for your time and attention.
Thank you very much, Michael, for that informative presentation. As you pointed out, the COVID-19 crisis has disproportionately impacted low-income Granite Staters, many of whom are still struggling from the effects of the Great Recession and had few resources to weather the current crisis. Next, I would like to introduce Eileen Laponis to share the New Hampshire Food Bank's approach to helping residents and families put food on their table and the increased level of need they are seeing in communities across the state. Eileen?
Morning. Thank you, Anne-Marie. And thank you all for joining us today. There's many friends on the list and other organizations that we work with, so happy to see us all here fighting the good fight. I'm going to go to the next slide, Mike. So the New Hampshire Food Bank is the only food bank in the state. Prior to a short infusion of CARES money, we received no state or federal money for our food distribution. We are a program of New Hampshire Catholic Charities and also one of 200 food banks of Feeding America. And we distribute our food throughout the state in a hub and spoke type model. We're being the hub as the only food bank. We have over 400 partner agencies throughout the state. Those are your traditional food pantries, soup kitchens, after school feeding programs. This past year, 2020, we had a 25% increase in our pounds distributed, with over 17 million pounds of food distributed through our 400 partner agencies and our mobile food pantries. We go after hunger not only through food distribution, but at the root cause of hunger, which is poverty. Food insecurity is not having consistent access to enough healthy, nutritious food to live a healthy lifestyle. And the reason is they can't afford it. And another reason somebody brought up in the chat room is transportation. Sometimes getting access is particularly difficult just because of transportation. So in our programming, we go after the root cause of hunger in our culinary job training program. In our production kitchen, we produce over 500 meals a day for our programming. After school feeding programs and other agencies of ours purchase meals through us. We also have Granite State Market Match, which allows folks who are SNAP recipients to double their buying power in farmers markets. And most recently, we are going to also be the fiscal agent for Double Up Food Bucks, which does much the same thing, but with fresh produce in the retail environment. We also have a SNAP outreach line for folks who are having trouble filling out the application. We have a Cooking Matters class that we do with Share Our Strength for nutrition education. Teaching folks how to stretch their dollar, how to really shop, looking at unit pricing, looking at how to prepare healthy foods on a budget, how to really stretch your dollar. We also have a production garden in Manchester, so folks know where their food comes from. A lot of volunteers and a lot of children used to go through there, really wanting folks to connect with their food and know where it comes from. We got about 10,000 pounds off of that 1 acre in Manchester every year of vegetables, so we're pretty proud of that. We also have a number of USDA feeding programs. We try to go to the rural areas where it's really hard to establish, work with our agencies to find out, where the kids gather, and try to put together a summer feeding program in the more rural areas where, like I said, where it is more difficult. If you can go to the next slide, Mike. So pre and post COVID, and my numbers are going to be a little different than Mike's because we get our numbers from Feeding America. They base everything off of poverty and unemployment. Pre-COVID, we were looking at about 9% of our population. Now we're looking at a little over 13. And I think that honestly, that number is low. But it's a huge number of people that we're talking about. We're talking about 55,000 people. And part of that is the child population as well. I think that number is definitely higher than 21. And I look at it also as SNAP recipients. And when you look at SNAP recipients, we have about 70,000 households in New Hampshire that receive SNAP. Pre-COVID, they said about 15% of the population that was eligible did not apply for SNAP. So that would be about 12,000 people. That was pre-COVID. So we have this many more families that are food insecure and that many more families that are eligible for SNAP. So there's a lot of work to be done out there. Next slide, I can show you how we're trying to tackle it. So we've had about a 40% increase in demands, and I know that doesn't match the 25% increase in distribution. Sometimes we don't have everything that our agencies want. We're seeing a huge increase in orders, larger orders more often. We've increased our deliveries. We've increased access to bulk commodities to our partner agencies who are doing much more. And we've just had a huge increase in food purchasing. When this all started, I'm sure you remember how the grocery stores were, had scarce shelves, and the grocery stores were a huge part of how we got food. What was salvaged at the grocery stores came to the food bank. There wasn't anything to salvage. So we started purchasing food in March right away because we could see what was happening. And just to give you an idea, we purchased more in the month of March than we did in all of 2019, and that hasn't let up. So we were very fortunate to receive the CARES money that we did to continue that purchasing and have a healthy inventory throughout this. The other way we've met the demand, and this was also to meet the demand and also to ease the pressure on our agencies, we had a huge increase in our mobile food pantries. Prior to COVID, we'd do a mobile food pantry, it'd be about 250 families that they were all privately funded. So we need about $5,000 to $8,000 to do a mobile food pantry, depending on the quality of the products and the mix, and that would do about 250 families. We, in 2020, did 70 mobile food pantries, all drive-through, no contact, and we served just under 30,000 families, and it was just under 2 million pounds of food. That's a tremendous increase over what we would normally do 5 or 10 in a year to get to 70. So we're doing about 3 a week throughout the state. And that's our way of meeting the demands, not only to decrease the pressure on our agencies, but also to give folks who haven't had to rely on social services before an easy way to help supplement their food sources. And it's no contact, it's just drive through. The only information we collect is what town are you from, how many families are you picking up for, and how many folks in the families. And that's what we're hearing. That's how we have our contact with the end client. And we're hearing that unemployment is increasing the number of people in the house. Some folks are moving in together, household members, whether it's children moving back in with parents, parents moving back in with children, siblings moving in together. There's more mouths to feed per household. We're seeing that in our numbers. And their folks are telling us that it's unemployment. And these folks, they haven't had the ability really. Mike, if you want to go to the next slide, I think I'm getting into some highlights. I try to be an optimist, and we're going to have some bright spots during COVID. But one of the bright spots was through our drive-through mobile food pantries. We had more contact with the end clients, and we were able to offer them other resources so that we could give them access to rack cards that had the SNAP eligibility requirements and the number to our hotline. So we saw a threefold increase in activity on our hotline and in our Cooking Matters classes, which were online. So there was kind of a double bang to the benefit of having these drive-through mobile food pantries. Also with New Hampshire Feeding New Hampshire, we've had a number of pilots throughout the years where we've tried to get farmers interacting with our agencies and providing products to them. And this year with the CARES money, I was able to secure 100,000 of that and make it a statewide program. And that was just tremendous. We had over 75 agencies, over 80 agencies and 75 farmers participate. And we're looking to double that this year. And we're going to raise to 200,000, and we're about 75% of the way there. And most of all, I'm hoping that there's greater empathy. So that folks who have experienced food insecurity or seen someone close to them, they can know how close they are and everyone is to being food insecure because of what this pandemic has proven to us all. And so I'm just hoping for greater empathy and greater awareness, and hopefully that'll bring about some systemic change, because there really is enough food for all of us. We just need access to it, and it needs to be redirected. And so while I am trying to make the line healthier and shorten the line of people in line for food, my colleague who's going to be introducing next is I'm hoping she's going to put me out of business, because we got to do this through legislative change. There's my segue, Anne-Marie.
Thank you. Thank you so much, Eileen, for sharing these insights and for all that you and your team at the food bank do to help our struggling neighbors in need. Thank you. Our final speaker, Laura Milliken of New Hampshire Hunger Solutions, will highlight some of the federal and state programs to address food insecurity and what might be done to more effectively help those in need. Laura?
Thank you so much, Anne-Marie. New Hampshire Hunger Solutions is an organization that advocates to end hunger and food insecurity in New Hampshire. And if we want to pave the way for a healthy and prosperous future throughout New Hampshire communities, we need to make sure that our pathways to opportunity in the state are sound. Before the pandemic hit, because of wage stagnation and rising costs of food, housing, and other basics, many communities in our state faced barriers to the resources that strengthen opportunity. As Michael and Eileen have shown today, the pandemic has made these challenges even more widespread and even more critical. When the way we manage our public programs doesn't keep pace with the needs of our communities, we can inadvertently perpetuate hardship instead of strengthening opportunity. And that's why facilitating access to federal nutrition assistance programs like free and reduced meals, WIC, and SNAP is integral to both family and community financial security in difficult times. We face challenges today that demand our creative thinking, and New Hampshire Hunger Solutions is committed to working with our public health partners, policymakers, state and local agencies, and partners in philanthropy to address those challenges. So what do we know? Well, New Hampshire's participation in federal nutrition programs is quite low. We know that New Hampshire is 47th among the states in participation in school breakfast, 36th in participation in SNAP, 25th in the summer meals program, 32nd in child and adult food program. And if you're not familiar with that, that's the meals in childcare. And New Hampshire had a 37% coverage rate for the WIC program. It's important to note that the free and reduced school lunch program provides critical nutrition to roughly 27% of New Hampshire children in participating schools, and that's a pre-pandemic number. When schools closed during the pandemic, that critical nutrition resource was disrupted. And despite innovative approaches and amazing efforts by schools to get meals to children in need during the pandemic when schools are operating remotely, participation rates in school meals are currently down 30 to 50% across the state. So all of this means that there are too many hungry children and families in the state, and that we're leaving federal dollars on the table that could help them. Thank you. We've always known that these programs are necessary, but not sufficient to meet the need. In New Hampshire, because of higher food prices, the SNAP benefit per meal is nowhere near the actual cost of an average meal. These are data that you're seeing on the slide from the Urban Institute, who compared the average SNAP benefit per meal to the average meal cost in each New Hampshire county and found it to be 40 to 51% below the actual average cost of a meal, depending on where you were in New Hampshire. Now, food costs have increased substantially during the COVID crisis. And while the recent COVID relief package increased SNAP benefits, it seems likely that there's still a gap. So what do we plan to do? Well, New Hampshire families need to know about these programs. Getting the word out about the programs that are available and how to apply is an absolutely critical first step. And we will be working on that. We also want to reduce the administrative barriers to assist families in applying for federal nutrition programs. New Hampshire Hunger Solutions is going to be working with school districts hopefully across the state, but certainly starting in Manchester and Nashua, to make sure families are able to access school meals during COVID and when children return to school full-time. We also need to ensure that we are collecting data critical to evaluating eligibility and enrollment. So as an example, we saw some of the slides earlier that currently the data show that WIC, for example, has seen a caseload increase during COVID, but the SNAP numbers have been going down or staying steady, and we really need to understand what's going on there and how to help folks. We also know that building the will to ensure these pathways to opportunity remain open will require improving the public's understanding of the causes, consequences, and solutions to hunger and food insecurity. And New Hampshire Hunger Solutions will be engaging in a strategic science-based effort to inform our communications about this issue. For example, we know that hunger is an issue that's too readily thought of as a personal responsibility or misfortune, with the considerations of the systemic drivers and varied consequences, both short and long-term, much less understood. So that's another piece of work that we'll be doing. Finally, our state is only as healthy as its communities, and our communities only as healthy as our families. So we must support approaches that remove barriers and open pathways to health and financial security. Thanks so much. Oh, and there's my contact information.
Thank you, Laura, for sharing these insights and for your work to ensure that more Granite State families and children are able to access food assistance.
Anne-Marie, you are muted.
Apologies. Thank you, Laura, for sharing these insights and for your work to ensure more Granite State families and children are able to access food assistance. And just a reminder too, before we move to the next segment, to please keep yourself muted if you're not a presenter or speaker. Apologize for that background noise there. Now I'd like to turn things over to Phil Sletton to moderate the Q&A portion of the event. Phil, over to you.
All right, thank you everyone, and thank you all for joining us this morning. So I'm going to direct a couple questions. I've been looking in the chat, and it's great to see that there's not only questions posed, but some people also weighing in with their information and perspective. So thank you for that. I'm going to take those questions. I've tried to synthesize a few and give them to our presenters today. The first one, and I believe this one was from Jim, was a question around the SNAP enrollment increase. Basically, why hasn't SNAP enrollment increased if there is increased need? And I will send this one to, and I noted that one of the responses was Jess noting Jess Garrier, I should say, noting that there was the application process can be a little difficult and can be cumbersome, and there can be other barriers between people's ability to get to that application process, and even once even recognizing that the application process itself may be cumbersome. So, but Laura, I wanted to go to you first around that enrollment increase and why we haven't seen sort of expanded enrollment that you might otherwise expect to see.
So the short answer is that we don't entirely know. You know, I mean, I think we can speculate based on the way the numbers went up in the spring and then dropped again in the summer, that when enhanced unemployment was counted as income last summer, that folks may have been become ineligible for SNAP. And then when those benefits decreased again, they may not have known that they could reapply. So I think that, but I think that, you know, it's important for us to really dig into why those numbers are the way they are, because SNAP is, you know, just a critical resource for folks during this time.
Thank you, Laura. And Mike and Eileen, I want to give you an opportunity to weigh in if you would like to as well. And I have a related question for you, Eileen.
Sure. I'm surprised as well. We're seeing an increase in our hotline. The activity on the hotline is definitely increased. And part of that is somebody mentioned in the chat box, can we connect food distribution and SNAP applicants? And that's what we do at all our mobile food pantries, is we pass out the application cards, eligibility requirement cards. So we're doing our best to get out there, but folks, you know, a lot of these folks just have never had to use or rely on any social services before. They just don't know where to begin. They don't know where to start. So there's a lot of education that needs to be done. We are starting engaging in a project with AmeriCorps, where we're gonna have 20 vistas in 6 regions throughout the state. And we're gonna try to really engage folks in healthcare to really screen for hunger, first of all, and then provide resources like the rack cards that we have that direct folks to our agencies and to SNAP applications. So it is a tremendous amount of awareness and education that has to happen in order for SNAP to really be taken advantage of the way it should be fully utilized.
And thank you, Eileen, because you anticipated my next question, which was around connecting folks to SNAP benefits. But I wanted to follow up as well. Francis had two questions, actually. One was about transportation, and you noted that you had seen that. I wanted to give you an opportunity to address that a little bit more as a potential barrier, as well as technology. Is technology a barrier for applicants as well?
Absolutely. Transportation, absolutely. When you get outside of Manchester, Nashua, and the Seacoast has a pretty good bus transportation system. It's very difficult to get around. Concord probably does as well. But North Country, very difficult transportation. Not a tremendous amount of grocery stores. In the past year, 2 grocery stores have closed up there. There just is not access to enough fresh products and enough grocery products in the North Country. So transportation definitely is an issue for the elderly as well. Transportation, they may be able to get there, but they can't carry everything back. So we have definitely some transportation issues in the state. With Catholic Charities has a couple of programs, one being caregivers, another being Monadnock, where folks really who want to stay at home. But the biggest issue that they're having is folks need transportation care. They need help getting to appointments. They need help getting to the grocery store, doctor's appointments. Transportation is a huge issue in New Hampshire.
And Laura and Michael, I want to give you an opportunity as well to weigh in on either transportation or technology, if you'd like.
I wanted to go back a little bit and echo the sentiments from Laura and Eileen about the initial question about SNAP enrollment and why we haven't seen an increase there when some indicators show that the levels of need have increased, especially when looking at the household pulse survey. Again, just echoing what Eileen said, is that a lot of these individuals who may be needing food nutritional assistance programs are newly needing them. They may not know that they are eligible for them, or maybe they were eligible for them initially when the pandemic began, but may have been disenrolled because initial unemployment benefits counted against some of the eligibility requirements for SNAP, and they didn't know that they could re-enroll, or they didn't know how to re-enroll. So just echoing those sentiments there and providing that additional insight as well.
And one component of Francis's question was around, is there a way for food that is closest, or pardon me, food closets to provide food to these households, I should say. Eileen, maybe you're the best to address that one as well.
Could you repeat that again?
Yeah, so I want to make sure, is there a way for food closets to provide food to these households? I'm wondering if it's also maybe the closest location to provide food directly to households.
Food closets? I mean food pantries, one of our partner agencies?
That may be the question, yes.
Okay, so yes, you're asking if they,
nodding, yes.
Okay. If they would provide SNAP eligibility requirements at the pantry.
Oh no, this is to avoid the transportation challenges, right? To have a delivery system as opposed to relying on people to get them there themselves. And I think, Francis, is that a correct interpretation? Yes. Okay.
Yes, some agencies do have delivery services, but again, it's all volunteer dependent, and our agencies have really struggled just to keep up with keeping their doors open with volunteers, let alone expanding services. But folks are getting more comfortable now. So that is a possibility, but again, it's up to each agency individually in the community, and then they have to get the volunteers in order to do the delivery.
Okay, thank you for that. And I want to also ask, which I believe Jim asked this question originally, why doesn't SNAP and why don't other programs address all of the needs that are out there relative to food insecurity? And I noted that I believe it was Lisa brought in the WIC perspective, the Women, Infants, and Children Nutrition Program perspective. But because Laura had a slide addressing this in part, I want to turn it over to her first.
Yeah, I'm not sure I have anything new to say about that. I mean, I think that, you know, it's SNAP numbers haven't been increased in many, many years, they don't match the actual costs of food for families across the nation, but New Hampshire food costs are higher. And so that's a good question. And I don't have an answer other than to say policymakers are not addressing it.
Michael and Eileen, if you want to weigh in as well.
Just an important thing to note about SNAP too is that the benefits are all fully federally funded as well. So these are federal dollars that flow into the state. And then the portion that New Hampshire shares with the federal government in terms of expenses is only the actual administration of the program.
One thing I'll note that's particular to the pandemic as well is that food costs have increased faster than overall costs recently. So that's a place where the adjustments in the aid may not be keeping up with the costs that individuals face when they are purchasing food. One question I just received and I wanted to integrate in here is that sometimes in food programs that are targeting children, there's low participation, especially during the summer. Is there a way to incentivize participation around those? And Laura, I see you nodding, so I'm curious if you have a policy idea.
I think that, I mean, it's not an entirely straightforward issue. You know, there are lots of administrative requirements for, and Eileen might be able to speak more to this because they do, the food bank does participate in the summer meals programs. But I think that, you know, there are ways to make it, the summer meals program, stronger. We could make choices at the state level. We could make choices at the community level that would support increased participation in summer meals. And that's one of the things that we'll be looking at. Eileen, you probably have more specifics.
There are some requirements that could make it easier. Again, it's education and awareness about these programs, and you know, our biggest enemy is shame and stigma. If we can conquer that, we'll get a lot more people fed. With the summer programs, it's also, you know, it's a small reimbursement from the USDA. So we always have private funds supplement it to make it, to round out the meal, shall we say. So there needs to be more education, awareness of the program, and make it more of a community event and less of what it is, and is the need for food. So there's a lot of social work that can be done around it as well.
The questioner did note stigma as one of the factors as well. So that is interesting and important that you identified that too. So I have a couple data related questions as well. And Eileen, I'm going to stay with you for a moment around the data that you showed on your slide, which referenced October. Were those data reflecting the situation in October, or were those estimates that were published in October? Published, I think you're saying. You were muted, sorry.
Yes, sorry. Published in October by Feeding America. Okay,
so they don't reflect necessarily what was happening on the ground in October, but that was reflecting the pandemic.
Correct, and that's why they are, I think the numbers are higher now.
Okay.
That was my reflection.
All right, thank you for that. And Mike, a question from Kevin. He was noting the relatively rapid drop in food insecurity in the sort of the two most recent data points that we have in those 3-year averages for New Hampshire. Of course, now, you know, we're in a pandemic, so once those numbers are updated, we'll see a different picture. But that period immediately prior to the pandemic, he was curious about what were some of the causal factors for that. You had talked about wages and seen that 20th percentile wage growth, but I wanted to give you an opportunity to address that a little bit more if you'd like.
Of course, I'm actually going to, so we can all see that slide, just share that slide as well and put it into full screen mode. So While I can't speak to the causal factors surrounding why food insecurity seemed, or the food insecurity estimates dropped more significantly in 2016 to 2018 and 2017 to 2019, what we do know is that around this period, especially 2017 to 2018, this is when unemployment levels dropped and stayed below 3% in New Hampshire consistently up until the pandemic began. And when unemployment is this low, it may have been providing more upward pressure, we'll call it, on wages, especially lower wages, which is why the idea that less people out there were working the minimum wage, and because of that upward pressure, more people were earning slightly higher than the minimum wage or even more than that. And that may have contributed to more individuals having slightly more income, putting them just above the thresholds that would push them into food insecurity, we'll say. So around that time period where food insecurity estimates really dropped off is when unemployment rates in the state dropped very, very low and stayed low through the pandemic, and may have been providing that upward pressure on lower wages.
Right, thank you for that. And I'm also curious, Eileen, if that trend that we see in the data, in the survey data, is something that you saw reflected in the sort of latter part of the recovery from the Great Recession. Did you see reduced demand? Obviously, it was lower demand than we have now and lower need than we have now, but did you see some of that decline in food insecurity?
Our distribution didn't increase significantly during that time. I have to agree with Mike on his points. I mean, it was driving the low wages up for sure. I mean, we were getting close to getting folks to $15 an hour. We work on East Industrial Park Drive. There's signs up and down. There were signs all up and down East Industrial Park Drive for what they were paying per hour, and they were going up, practically every month that we were going down. So I would have to agree with Mike on that. And I didn't see a significant change in our distribution to say that we were a part of it.
Okay. I'm going to ask both Michael and Laura about comparisons across states. Ray had a question around what are some of the different policies, particularly SNAP-related policies, that may make a difference from state to state in terms of food insecurity. Is there any analysis that provides some insight into that?
So during the pandemic, there are waivers that can be implemented, that some of which New Hampshire has implemented that make it easier for recipients, and some of which New Hampshire has not and other states have. So for example, you have the ability to waive the interview portion and the recertification interview, and that hasn't happened in New Hampshire. So there are some things, administrative barriers that we could do differently. And then the second part of the question was about the, sorry.
Is there analysis available to show the differences that these policies might have on food insecurity between states?
Yes, I believe so. Yes, absolutely. I mean, at a minimum, I showed you a slide with rankings relatively to other states about our SNAP participation rate. But yes, we've been looking into sort of what options there are for the state to choose differently in terms of who is eligible and in terms of what the barriers are to participation.
And Michael, did you have something as well?
I did not have anything to add for that question.
All right. One thing that I'll note historically in New Hampshire that we've seen is that when entering the Great Recession, when New Hampshire expanded categorical eligibility, so it enabled more people to be eligible under expanded categorical eligibility, then we did see enrollment increase. That expanded categorical eligibility is still in existence in New Hampshire. However, it is not as expanded as some other states. I haven't seen any analysis that explicitly compares New Hampshire to other states. New Hampshire is actually relatively unique in how it sets forth expanded categorical eligibility compared to the I think roughly 39 other states, or maybe more now during the pandemic, that have expanded categorical eligibility as well. I know Susan asked, do food insecurity rates vary within the state? And if so, how? And Michael, I'll turn this one to you first.
While the USDA's official estimates of food insecurity don't go down to the sub-state level, estimates via modeling through Feeding America, like some of the estimates that Eileen was presenting, do, and they indicate that food insecurity is higher in some of the major population centers of the state, like Nashua and Manchester, and also higher in some of the much more rural areas of the state, like Coos County, for example.
Okay, and Laura and Eileen, if you want to weigh in as well, Eileen, if you could provide us with some insights.
Yeah, Feeding America does an analysis by county, and Mike's dead on. The rural area, Coos, is definitely the most affected by food insecurity, and then it is the urban areas as well.
And Eileen, if I could stay with you for a moment, and I'm trying to catch up on the questions that have been in the chat, so thank you for submitting them, everyone. Francis also asked about libraries and town halls closed, and does that mean that those without smartphones or computers have difficulty connecting with aid? So this is kind of back to the technology question, but not just around the wading through technology, but the accessibility period of technology.
Absolutely. We know technology and transportation are huge barriers. We have folks, English is a second language on the line. There's a lot of barriers besides technology, but being able to get through the process. I noticed somebody said that the process itself is not easy, and it's not. And the way it's set up in our state is we don't have access. Once the application goes in, we don't know if the application was successful, whether or not the person received it or not. So for us, it's very difficult to feel successful at our application process, but that's just the way our state is set up. And I'll say our state has a very small department for SNAP, and they have a Herculean task that they are do the best they can with a very, very small staff.
So, and I'll ask a potentially related question. Are there conclusions, and this is from Ray, are there conclusions that we can draw from the fact that SNAP applications are generally increasing at the end of 2020 and compared to the prior year's numbers, but enrollment numbers are still down compared to where we were prior to the pandemic? Is there something that can tell us? And Laura, but I don't want to, can I go to you first for that?
Sure. So, I think, again, I don't have a definitive answer. I don't have the data that I need to be able to answer that question definitively. But I think it really does bear digging into what are the administrative barriers that are keeping people from getting onto the program and getting the help they need. SNAP is not the only program for which we need to do that analysis, but SNAP is the most concerning because it's designed to meet the need during downturns, and it doesn't appear to be meeting the need that we expect. So I think that we need to explore that much further.
And I'll stay with you, Laura, for a moment, if I could. Jim asked a question around states with exemplary SNAP processes. Do you have an example in mind as to a state that that does things differently than New Hampshire?
Sure. The state of Vermont does a very good job at enrolling folks who are eligible in SNAP and meeting SNAP needs, for example.
Mm-hmm. Yep. And I should say, that's not to say that New Hampshire doesn't do an exemplary job. It's just there are other examples that we can all learn from that would be, especially given in the pandemic now, if applications are up, there's more to process there. So
absolutely. The folks who are administering these programs are doing their very best. I think that though we need to look at the systemic issues that are happening and policy issues that affect the programs. And as Eileen said, we need to note that our SNAP office in particular has been down staffed considerably. So, now that the state hiring freeze is over, we may, they may be able to do more to look at these numbers and really figure out what's going on.
Right, and I want to. There was one question as well from that's regarding New Hampshire lagging behind national numbers in some ways. We were sort of last to. We were. The recession here had a shallower impact, and New Hampshire sort of recovered a little bit more slowly from the Great Recession. If this is the same pattern we're seeing in food insecurity, why might that be? So Mike, I'll ask you first around sort of that slower economic growth and maybe slower reductions of food insecurity as a result. Is there something that's what might we see there, and does that tell us something about New Hampshire maybe relative to the country?
Sure. So the big thing to remember is the connection between someone's economic security and food insecurity. So these individuals with lower economic security, individuals who are earning lower wages, have lower incomes, are more likely to be food insecure. So over the recovery from the Great Recession, when we saw the declines in real wages of lower wage earners being more suppressed in New Hampshire and staying suppressed for longer compared to the nation overall, that explains the connection as to why, or that may explain the connection as to why food insecurity levels remained elevated for longer in New Hampshire than the nation overall. So given what we know about that connection between, we'll just use wages as an example, and the incomes of individuals and food insecurity. And then also looking at, policy environments, for example. Other states that may have more robust policies to support lower income individuals and lower wage earning individuals and families may not have experienced this elevated level of food insecurity for longer, and that may be something to think about when comparing, what might happen in the future for New Hampshire relative to what we've seen in the past.
Okay, thank you. And Laura and Eileen, did you want to weigh in as well on any of that? Okay. One thing that Jess just noted in the chat is that there may be a relationship between food security and education funding. Could one of the three panelists speak about the role that educational institutions play when it comes to food security, local public schools and that sort of thing, and how, to maybe describe how there may be a connection to education funding. Eileen, could you speak to that? Not the education funding piece, but the role that public schools play.
They do a Herculean job of providing sometimes the most nutritious meal a child's going to get in their day. And we can't say enough for the need of that programming to continue and to strengthen. One of the programs that Massachusetts did, Laura, back me up on this, I can't remember legislatively, but they did a after the bell breakfast program. And I wanted to see if their numbers increased after that. That was something I was hoping that New Hampshire could emulate Massachusetts with. But I'll pass this one on to Laura. It's more of a legislative connection than.
Yes, absolutely. Laura, go ahead.
So New Hampshire schools are dealing with a lot. The school funding issue implicates how schools do everything. So, we're 47th in the nation in participation in school breakfast. And I don't think it's because schools don't care about feeding their students. I think it's another thing that they have to figure out how to do more. I think it's not well understood. I think people understand that that eating breakfast improves health, but I think that it's not well understood that it also improves academic performance. It reduces behavioral issues. You get fewer trips to the nurse with stomach and headaches. You have stronger attendance and stronger graduation rates. And I think schools need help figuring out how to structure breakfast to make it appealing and accessible to students. Breakfast after the bell is a way of providing breakfast. Generally, you do it in the classroom, which can much lower the stigma around, folks who are free and reduced coming in early and being pegged. So schools, I think, need help figuring out how to do it, how to pull down the federal dollars in a way that makes it economically feasible for them to provide breakfast. But it's absolutely critical. The data show a huge number of positive outcomes, and not just for free and reduced kids, for all kids.
So I think that I have processed through all the questions that I have anyway. So one thing that I wanted to do, however, is I know Lisa spoke to the WIC program as well. And I think Lisa, if you wanted to say anything else regarding the WIC program, because I believe you work with it. So if you wanted to say a couple things about your perspective, then I would welcome that.
Sure, thanks for the opportunity. So I did put a little information in the chat, just that WIC is much more focused around pregnancy and birth outcomes and child development for school ready, and less about food insecurity, but certainly we play a role with our partners. And it is unfortunate that in 2017, we had a 37% coverage rate, which you can never really get USDA to explain how they get that number. They just put the report out to you. But we made some great progress at the end of 2017, 2018, 2019, and it continues now that SNAP and WIC are working really closely together in New Hampshire, and we have a data sharing agreement. And so families that are enrolled in SNAP are automatically offered the opportunity to enroll in the WIC program too. So we are working behind the scenes to remove some of those barriers that we know our families face with trying to apply for multiple different programs through multiple different pathways, presenting proofs multiple times. So we're getting there. It's sometimes hard, especially when you have different funding sources. For SNAP and WIC, certainly we're both funded by USDA. So we've had great support at the federal level for the work that we're doing.
Thank you, Lisa. Thank you for jumping in the question and answer section here. Raymond asked a question, does the SNAP WIC data sharing work in the other direction as well? In other words, if a family is enrolled in WIC but not in SNAP, are they given the opportunity to enroll in SNAP? And Lisa, if you're willing to field that, and I saw you unmuted, so I hope you are, then I think it goes best to you.
Sure. So it's a little bit different, not as automatic as it is from SNAP to WIC. But in the WIC program, we are federally required to ask about enrollment in Medicaid, enrollment in SNAP, and enrollment in TANF. So we do facilitate and help families if they have not yet applied for SNAP.
Okay, great. Thank you very much. And with that, I don't see any additional questions. So I wanted to go to each panelist and see, are there any questions you saw that I missed that you want to address, but also are there any closing comments that you have after the Q&A session here? And Eileen, I'll go to you first.
I'm just happy to see the number of participants, people really engaged in food insecurity and looking for solutions together. I'm very, very happy to see all of us fighting the good fight together and collectively coming together out of our silos, locking arms, and really trying to tackle this together. Thank you all for coming out.
Okay, thank you, Eileen. And Laura, I'll go to you next.
Yeah, and similarly, I mean, as I said earlier, these are unprecedented challenges that we're facing today, and we really want to work with all of you and with our, public health policymakers and state and local agencies and partners in philanthropy to address these issues. I look forward to that. Thank you.
And I did get one more question, so I'll submit that to you all at the end. But Mike, I want to give you an opportunity to say for a moment as well a wrap up of the questions that we've had, at least thus far, minus this one that I'm about to ask.
Yeah, so I don't think there were any missed questions, but one thing I wanted to make sure that everyone remembers as a main takeaway is that programs like nutritional aid programs like SNAP are very effective at mitigating food insecurity and also stimulating the economy while the economy is weak. So it's critical in this time for programs like SNAP to reach the people who need the benefits in order to support them now in the short term, while also stimulating the economic recovery out of this crisis as well.
Okay, thank you, Michael. And there was a good segue there around this particular time. I have a question that is suited to this this moment, if you will, the pandemic in particular, is around the, we've talked about public schools a fair bit. This question is around remote schooling and how that has affected free and reduced price school meal enrollment. And this is something that I know I've seen a little bit of newer data that's come out of the the Department of Education around this, but I'm curious if any one of the panelists can speak to that.
Hi. So the data collection during the pandemic has been a little bit different because of the way that federal waivers are available to schools. So data isn't being collected the way that it was before the pandemic, which makes it really hard to know about participation in free and reduced meals in particular. So we know that participation in school meals in general across students, including paid students who would have been paid or in free and reduced, is down 30 to 50% across the state. But what we don't know is what percentage of those folks are the free and reduced population and who are the paid families. So that's basically the best I can do, because we just don't have those data.
Mm-hmm. And Eileen or Mike, did you want to weigh in as well?
I think that Laura captured it very well. It's hard to be able to draw comparisons to new data because of the way the data collection has changed.
Yep. Okay. One thing I'll note as part of that connection to free and reduced price school meal enrollment as it is captured in Department of Education data is that affects the funding that school districts receive. There's a certain amount that's added on to the Opportunity for an Adequate Education grants that are received by school districts on a per pupil basis. Those there's an additional amount for a student that is enrolled or known to be eligible for free and reduced price school meals, which is roughly synonymous with enrollment. And a lack of enrollment or a drop in enrollment that would then lead to fewer dollars, fewer state dollars to fund local public school districts. And Laura, I saw you unmuted, so I didn't know if you wanted to chime in as well.
That was my mistake. No. Yeah, that's the unintended consequence of there having been these waivers, federal waivers having been implemented. We love the fact that the waivers allow schools to serve all children regardless of their income levels. But the unintended consequence is that they're not able to get the numbers on how many free and reduced families are participating, which implicates a whole range of other federal programs.
Go ahead, Eileen. Yes.
Yeah, if I could just say, Senator Shaheen's office is addressing this, and one of the things that they're looking at is taking the previous year's free and reduced numbers and applying them going forward, so that we don't at least go back, so we don't lose any ground, so that it is being addressed, just to let you know.
Yeah, and we do hope to do some work to get the word out about the need to apply for free and reduced, even though it isn't a requirement to access the meals that schools are providing.
And to that point, so thank you both for that, and thank you all for weighing in. I believe that Madison Lightfoot from Senator Shaheen's office is also on the line. I haven't seen her yet, but Madison, if you wanted to speak to that, if you could speak to that issue, then you are welcome to do so. Well, maybe she had to drop off.
Yeah, it looks like she did. Apologize for that.
Okay, nope, no problem. So thank you to the panelists. Thank you for the questions, and I'll hand it back to Anne Marie.
Great, thank you, Phil, for your expert work moderating that Q&A session, and a special thank you to Eileen, Laura, and Michael for sharing your insights this morning. I'd like to extend our gratitude once again to the New Hampshire Children's Health Foundation for their support of this research project and today's event as well. And I'd also like to thank everyone who joined us here this morning. We hope that you found this event to be informative and that these resources will be useful for your work. It's really wonderful to see so many people engaged in finding solutions and working together to solve this critical issue. So we will be posting the slide deck from the session and the session recording online at our website, along with a summary overview with some key points from Michael's presentation. So we'll be posting those all at our website, NHFPI.org. And we'll be sending each of you an email with links to all of these resources. I hope we'll get it out today. If not today, then look for it tomorrow, but it will be coming soon. And so that concludes today's program. Thank you all once again for joining us this morning. Stay safe, be well, and enjoy the snow. Have a great day.